Infertility is a condition that affects over 600,000 Canadians, or roughly 10% of the reproductive age population. Infertility is defined simply as a persistent inability to conceive a child. It affects men and women equally, but it's a condition, thanks to many medical advances, that people are able to overcome in a great majority of cases these days. This video is designed to help you understand the different approaches to conception available and help you choose the one that's right for you. Along the way, we'll answer some of the most common questions, but don't hesitate to ask your doctor about anything that concerns you. Thankfully, your chance of having a healthy pregnancy is influenced by many factors that you can control. They all boil down to something that we might call the 6 habits of highly effective fertility patients. These habits are useful for anyone trying to get pregnant. Taking a supplement of 5 milligrams daily of this B vitamin can lower the risk of birth defects such as spina bifida. All women need folic acid every day, and you should begin taking yours at least 3 months before trying to conceive. Topping the daily vitamin up with a healthy diet of green leafy vegetables, beans, and fortified cereals will only help. A visit to your doctor is your first step in addressing medical pregnancy issues like high blood pressure, diabetes, lupus, kidney disease, and seizures. Achieving a healthy weight through a balanced diet and moderate exercise is also key. Your doctor should be consulted before all significant changes. Smoking, alcohol, and illicit drug use can all complicate conception and affect the health of your child. You should also cut your coffee down to 2 cups a day. And look for healthy alternatives to your usual habits. All of this should also help towards lessening any stresses in your life, which can be another hurdle for achieving pregnancy. Make sure your vaccinations and immunizations are up to date. Vaccinations for German measles are necessary for those at risk. Chickenpox and hepatitis B are also highly suggested, and your doctor may also recommend other vaccines, such as the flu shot. It's best to check into your vaccinations early, as many of them need to be given at least 3 months before pregnancy. Your environment is equally important to a healthy pregnancy. You should stay away from solvents, pesticides, and harmful chemicals. You should also have as little contact as you can with cat or rodent feces to avoid the parasitic disease toxoplasmosis. Get a family member to change any pet's litter box. For men, there are several steps that can help optimize sperm count. Having intercourse or ejaculating every 2 to 5 days will maintain an optimal sperm count. You should avoid exposure to chemicals and lubricants, which use petroleum jelly or spermicides. And while many people have heard about avoiding hot tubs and saunas, you should also cut back or stop the use of alcohol, cigarettes, and marijuana, and try to wear loose cotton underwear. As with much of what we'll talk about here, knowledge is the key to your success. So remember our 6 habits: a daily dose of the vitamin folic acid, your doctor, lifestyle choices and minimizing stress, up-to-date immunizations, avoiding toxins, and optimizing sperm count. All of these are things you can work on as a couple. All of them can have a big impact on your path to successful pregnancy.